I'm Sheetal Bavishi. I am the assistant professor in the Department of Physical Medicine and Rehab. I'm also the medical director of the brain injury program at Dodd Rehab Hospital. I see both inpatients at Dodd and outpatients for brain injury rehab and other rehab needs. So some of you that are on this chat, I've actually worked with you, or I'm currently your doctor. And so a lot of my 100% of my practice deals with patients with brain injury. And what I do is after patients are in the hospital or after they've had their injury, I work on the recovery aspect and improving that from every cognitive, physical, and everything like that, and working with the PT, and speech therapists, as well as the rehab psychologists and a whole host of other team members that help us with our brain injury. So a lot of what I wanted to talk about today is we've heard a lot in the media with COVID-19. And, a lot from CNN, from Fox News, from Governor DeWine, from the president. So it's all a lot of confusion at times. Sometimes it makes perfect sense. So what I wanted to do is just kind of get back to the basics. We've talked about COVID-19, we've talked about coronavirus, but what actually is it? So novel coronavirus is what it is, and novel means new. So it's a new strain of coronavirus. We've had coronavirus around for years. Some of the SARS that was around several years ago, when we called it the bird flu, that was a type of coronavirus. So it's not that coronavirus is a new virus at all, but it's definitely changed its strain. So it's a new strain. It's gotten smarter and smarter over the years. It's similar to influenza in the fact that influenza is a virus as well, but there's some vast differences between those. The big thing from the coronavirus that we currently have is that it is spread by respiratory droplets. So when they talk about, cough etiquette and sneeze etiquette, cough into your elbow, cough into your arm, sneeze into your arm, or don't sneeze out without covering your sneeze or your cough. These are things we probably learned when we were kids that our parents probably said to us, you should be doing this. But it's pretty surprising how quickly a sneeze or a cough can come on and you don't have the reaction time as quickly, especially for our patients with brain injury. Sometimes something just happens and you don't have the fast reaction time, and that's okay. But that's another reason why, when we do cough or we do sneeze, and if it does touch an object or touch a surface, or we're not able to cover our mouth quickly, knowing that that virus, especially coronavirus, could be on other surfaces. So even if you sneezed or coughed, but what if someone else did and you walk up to that surface and you touch it? You don't want to take your hands without cleaning your hands and then touch your eyes or your nose or your mouth. Because yes, this travels via respiratory droplets, but it can also stay on surfaces, and I'll talk about that in a little bit. So I think some of the big things, though, is what does it affect? We hear about in the news, we need ventilators, especially in New York City, they were out of ventilators, or in Chicago, they were talking about, or in Illinois, they were talking about who's going to be a person that gets a ventilator. Or you hear stories about, people in Italy giving up their ventilators for someone else. So the coronavirus mainly does affect the lungs. So when someone coughs or sneezes, or if the virus is in the air and you breathe it in, it mainly affects the lungs. But it can affect other organ systems. A lot of things that we're learning right now is that it can affect kidneys, heart, it can affect blood vessels. So we're in New York, they're seeing that some people are having strokes, and they maybe don't have a fever, they maybe don't have other symptoms, but they're having strokes, especially at a younger age. So we're learning every day. We're learning more and more about what this virus can do. But there's a big thing. It is not like the flu. It is definitely much more virulent. Virulent means it's much more aggressive. It spreads faster. It can cause more symptoms. It can cause worsening symptoms, especially for people that have a decreased immune system. So you hear about the elderly having a decreased immune system. You hear about people with different medical conditions like heart disease or cancer or something like that. And they do have compromised immune systems. And this virus is so smart that it goes and it's trying to live on its host. It's trying to be what a virus does. It's trying to live. When it tries to live, it's affecting the humans. It's affecting us from all organ systems, mainly the lungs. And that's why we're looking at, there's a shortage of ventilators out there. But how is coronavirus not like influenza? So they both are respiratory viruses. They're both a virus. But with COVID-19, what we've found out is it has this faster spread. So there's something called a basic reproduction number. And that number tells us for every one person that has it, how many people can they potentially infect? So with COVID-19, the reproduction number is 2 to 3. Whereas with influenza, the reproduction number is 1.3. So it doesn't seem like a huge difference, but I'll show you in another slide how one person infecting potentially 3 people compared to one person infecting potentially half a person or just one person, and how quickly it can spread when it infects more people. The other big difference is COVID-19, and you all hear about you need to quarantine for 14 days. Well, the reason why that is because the coronavirus can live and incubate in our system without causing any symptoms at all for up to 14 days. So people that were coming off of cruises, people that were, traveling to hot spots around the world, when they came back, we were asking them to quarantine for 14 days. So that way, if they did get infected with the virus and they were going to develop symptoms, they were staying away from other people and potentially affecting other people until we determined if they were someone that was infected and they developed symptoms. The difference is the flu, it has a really short incubation period, 3 to 5 days. So if you get exposed to the flu virus, you know that you have it within a few days. Whereas we don't know that with COVID-19. The other thing is the death rate. Yes, when we look at overall influenza, the amount of people so far that it has killed over time is more than COVID-19, but it was in a longer span of time. So when we think of the 50,000 deaths from influenza in the last year, it was a whole entire year. We're talking about over 50,000 deaths from coronavirus in 4 months. And not even, because we really, when the first cases we saw in Seattle and we're seeing them spread throughout in New York and everything. And by the time Ohio and other places started doing all of these lockdowns and stuff, it was really February. So, the virus was probably here in January or even before then, but we really didn't start doing something about it until February and March. So, but just from January through, the end of April, that's 4 months. And in 4 months, it's had the same death rate as what influenza did in a whole year. So those are the things when people are like, well, it's just the flu. It's like but it isn't. It isn't. It's a lot more. It's a lot more aggressive. The other thing with influenza, we have a vaccine. So there are vaccines available for the flu. People talk about getting a flu shot every year. The vaccine, there's no vaccine yet for COVID-19. And we have been talking about that in the news and everything. They're creating vaccines. But sometimes to create some of these vaccines, it could take months. We may not have a vaccine until the end of the year or until the fall, because we don't know if we're going to catch if the strain of the coronavirus that they isolate, and then if they can make sure that it's in what we call a medium, so what the testing medium, and then we have to inject it into human subjects. We have to find out if it's even safe for humans to use a vaccine that was created. So right now we don't have a vaccine, which is another thing that's very concerning in a bug that's really spreading rapidly. The other thing is we hear all about, we have plenty of tests and we don't have enough tests, and we have plenty of tests and we don't have enough tests. Well, the answer is we do have testing, but right now the testing is limited to those people that have symptoms. So if you have symptoms, you can get tested. Do not worry. You will be able to get tested. But we don't have testing where just anyone can walk in and say, I want to be tested for coronavirus, because we don't have that widespread of testing. But we can get testing. There's a lot of new testing that's been created. Ohio State has a new testing with rapid tests that we're getting results back pretty quickly on our in the hospital setting. It's still taking a few days for our outpatients to get their results back, just because of collection of the test and then getting it sent to the lab. But for the patients that are in the hospital, we're getting the test back pretty quickly. But again, these are people that are symptomatic. You have to have a doctor's order to get the testing done. Ohio State has a COVID hotline where if you're already an Ohio State patient, you can call it, and they'll ask you a series of 20 questions, and those 20 questions will have a bunch of things like, were you exposed to someone? Do you have fevers? What are your symptoms? And then they'll determine if you'd be a candidate, you need to have the testing done. There's actually, so the nurse will actually be the first person on the line that'll go through the series of questions. There also are doctors manning that line that they'll be writing the orders for it. You don't have to call your family doctor, because there is a doctor on that line that would be writing the prescription. And then they'll tell you to go to one of the testing places. We currently have the testing over at Ackerman, for you just drive up, they'll test you, and then you drive home, and then you'll get your results in a few days. So we do have the testing, but it is really reserved right now for people that are sick or people that are in the hospital. And then the last thing is we've heard about all these different potential treatments. With the different antiviral medicines, the immunosuppressive medicine that we use for patients, like hydrochloroquine. So, but none of them have enough data behind them to show that they're the best treatment. We've also seen that with some of them, people are having really bad side effects, with their heart, with their kidneys, with their liver. So we really are trying to find a treatment that's going to give an answer that's going to help, but also not cause a whole bunch of other problems. So we don't have a true FDA-approved treatment. Doesn't mean that people aren't getting some of these treatments. So, when you hear about the convalescent plasma and you hear about remdesivir and like the different antivirals, we are using them. They are using them at the hospital. They are using these treatments, but they're not finding that any one treatment is perfect for everyone. So what we have noticed is that we're trying one treatment. If it doesn't work, we try another one. But there's nothing specifically in the FDA that says this is the treatment for coronavirus. Unlike the influenza, you get a fever, you get tested, you have the flu, your doctor's going to prescribe you Tamiflu. And you start taking that right away. And that's the treatment we have for influenza. We know it works. But we don't have that yet for coronavirus, which is another reason why it's very different than influenza. So there's a lot of those things. Yes, it's a virus. Yes, it infects the respiratory system. Yes, people get high fevers. However, there's a lot of very significant differences between the two that make coronavirus a lot more concerning than influenza. Is still concerning, and there's a high death rate with it. But for right now, the coronavirus is a lot more concerning than the flu. So when I was talking about that reproduction number, so this is basically, if you guys can see my mouse, basically if one patient, so this is patient 0, and if we have the reproduction number of 2, they infect 2 people. Well, those 2 people go out and infect another 2 people, and those 2 go out and they infect 2 more. So in a pretty short amount of time, one person can infect 16 people overall. So, but when you have like with the flu, you have a 1.3 reproduction number. So one person will infect half a person. Well, that person will only infect one other person. That person will only infect one other person. So by the end of it, you're looking at not that many people being infected, because it doesn't spread as quickly, and it doesn't spread as widely as the coronavirus does. So how do we keep safe? And we've seen the commercials, we've heard it time and time again, but I can't say enough how washing hands for at least 20 seconds, and we always tell people, sing the happy birthday song while you're washing your hands. It is the number one thing for any infection, but especially this one. So when you're out, use the hand sanitizer that's there. Clean off your shopping carts. You don't have to wear gloves as long as you don't touch your face before you wash your hands again. So you can, a lot of the grocery stores and stuff, they are wiping down carts and stuff for you. They have hand sanitizer. So we'll talk about the Ohio Department of Health. There are some things that they're requiring some of these businesses to do. So they are trying to keep people as safe as possible. So there's a question always about, do you wear a mask or do you not wear a mask? The answer is you always wear a mask. There's been a lot of, pictures out there, memes out there. You go on Facebook and people are posting all of this stuff about how, one infected person wears a mask and someone doesn't, and the rate of transmission. But then when two people wear a mask and the rate of transmission is a lot less. That is true. You're doing two things with the mask. One, you're trying to decrease, if you cough or sneeze, if you have the virus, you're trying to decrease the amount of virus you're putting out in the air. But you're also, with the masks, trying to decrease the amount of virus coming in. Any mask will work because the main thing is just trying to have something that's a barrier. We talk about cloth masks, they talk about surgical masks, they talk about N95s. The N95s are really for people that are going to be in direct contact with somebody with coronavirus. So our healthcare workers, our nurses, our doctors, our environmental folks that go into these rooms that patients have coronavirus and they're treating them, they are the ones that need that because they're the ones that have the most exposure. When you're out in the community, as long as you're staying 6 feet away and as long as you have some kind of a mask on, whether it's a cloth face covering or a hospital grade surgical mask, you're doing okay. You are definitely keeping yourself as safe as you can. Don't touch your face, eyes, and mouth. We hear that all the time. And the reason why that is because our face, our eyes, and our mouth, they have a lot of glands. They have a lot of places where even if the virus is there, it can easily go into your mucosa, which is that lining of your mouth or the lining of your nose. And your eyes are very moist areas where it can get in. So trying to avoid touching any of that. I know the first day that I was told don't touch your face, eyes, and mouth, the first thing I wanted to do was touch my face, eyes, and mouth. So it can get hard, but putting a mask on I wear a mask all day long at the hospital, and I don't ever want to touch my face because the mask is in the way. So when you leave the house and you have a mask on, you're going to be less likely to do some of that stuff. And then the stay-at-home orders, the answer is yes. If you need to leave, essentially, if you have to go to work, you have to go to the grocery store, you have to go to the doctor, go ahead and leave the home. A lot of what we're seeing, a lot of people are saying, well, I had chest pain, but I'm too afraid to go to the hospital because I might get coronavirus. Your potential to die of a heart attack is going to be far greater if you don't go to the hospital than you getting coronavirus in the hospital. A lot of the emergency rooms are having separate locations where they're putting people with potential coronavirus or where they are putting them in to rule them out. They're keeping them away from the other emergency room population. The ERs have specific triage centers where they're triaging people that they're concerned about with coronavirus. So they're trying to keep them away from the regular ER population. So do not, by any means, stay home if something is going on and you need to see a doctor or you need to go to the emergency room. There are urgent cares. Ohio State has an urgent care that they're specifically seeing patients that could potentially have coronavirus or those type of things. So look at the Ohio State website. There's a lot of different things that they're doing, but don't stay away from the hospital or the emergency room if you have a big problem. Don't stay home if you feel like you're having stroke symptoms or if you feel like you're having chest pain or any number of things that could bring you to the emergency room. Go to the emergency room. It is better for you to get checked out than to try to stay home and suffer through it and then potentially not make it through it. So, and then our other last thing is maintaining a safe social distance. So when you go to places, they're going to have stickers out where they want you to stand, to stay away. Everyone always asks, well, what is this 6 feet number? So there's been a lot of studies. They did some in Korea, they've done some in China, they've done some in Europe. And so they're looking at, how far can the virus travel? If someone coughs or sneezes or whatever. And so far, they're saying, well, the closer you are to someone, the higher likelihood is that virus is going to get into you. So the answer is that the 6 feet number was looked at based on some data. It's not the official data. The further you can be away from people, the better. That's why we're having people stay at home. But at least 6 feet if you have to be somewhere close. So this was what I was going to talk about, is how long does it last on surfaces? People are talking about, oh, I have to go to the store and I come back and I have to leave everything in the garage, or I have to wipe everything down. There are certain things, yes, like if you go to the grocery store and you're getting some non-perishable items and they're in cardboard, don't wipe down the cardboard with an like a Lysol or a Clorox wipe, because the cardboard isn't made for that. So it could, degrade that cardboard. Leave it outside in the garage, if it's something that's not perishable, for 24 hours, because if there was a virus on it, it'll be killed in 24 hours. In the air, this is the reason why we talk about wearing masks. If someone coughs and they didn't have a mask on, it could linger in the air up to 3 hours, especially if you're in a closed space. If you're outside in the park and that type of thing, it moves pretty quickly. It may not linger that long. It might linger a lot less. Stainless steel. So, we all have our little coffee mugs or our water bottles. Well, what I do is I wipe mine down at the end of every day before I go home, because it could potentially last on stainless steel for 72 hours. Wiping down surfaces, with the restaurants, some of the things that they're going to be doing is these enhanced cleaning measures when they finally do open up. So those are some of the things to think about. And in plastic, it can stay up to 96 hours. So those plastic water bottles or, other things, those you can wipe down. Those you can wipe down with the Lysol wipe. But you can also keep them outside, in your garage or something like that. But those potentially could. On the left, I just have a graph that was New England Journal of Medicine, one of our big journals that we read in medical literature. And there was a group that did a study about how long can the virus last on certain things. So this was kind of the results of their study. So I put that up there just to kind of help you guys understand, like, for the different surfaces. So like for aerosols, that means the air. This is how many parts there were, or parts per million, the titer of it. And this is hours on the bottom. So it does decline over hours to kind of a low or negligible rate. But if you look at cardboard, it's pretty fast. These are hours up to 80 hours. It goes down to 24 hours. This is plastic. It's kind of over 80 hours. So that's why they're saying, with some of these things, try to clean them off. Try to keep them in places where if they're non-perishable, they can. The number one thing is also just wipe off the countertops. So, I come home, I bring my groceries home, and then I use the plastic bags from the grocery store. I throw them away, and then I wipe down the surface when I've taken out all of the boxes. I don't wipe everything before I put it in the fridge. But you can. It doesn't hurt. But just make sure that what you're wiping down and what you're wiping it down with, because some of those chemicals can stay, and you don't want to eat those chemicals. So the Ohio Department of Health, so they came out with the new codes for when we're reopening everything. It is as clear as mud to some people. So I tried as hard as I could to put together some slides with things that are happening. This is as of May the 4th. So businesses can reopen with the following exceptions. So retail businesses can't open till May 12th. Restaurants and bars cannot open except for carryout only. Schools are remaining closed, adult daycare, beauty salons, entertainment, recreation places, child services, and older adult daycare will have to all remain closed. The only part of child care services that can open is if they've applied for a temporary pandemic child care license. So, but the businesses, when they do reopen, they have to make every effort to maintain social distancing. So you're going to see, like I talked about, you'll see, whatever color they use, most of them are using blue. That'll say stay 6 feet away, and that's where they want you to stand when you're at the stores or when you're anywhere. Now, at first, Mike DeWine did say that they want everyone to wear a face mask for patrons and employees. However, then he rescinded that and said that they were going to recommend it. There are still some places that, even though they're putting up signs saying we recommend it, there are some stores that are saying absolutely not, they're not going to let people in without a mask. So and he left it up to some of the businesses. So when in doubt, wear a mask. But there might be some businesses, if you absolutely decide you're not going to wear a mask, they may not let you in. And that is business dependent. Even though it's recommended, he's still allowing some of the businesses to have a stricter protocol if they want to. All the businesses have to have accessibility to hand sanitizer or sanitizing products. So, bathrooms to wash your hands or hand sanitizer. Some of them, and all the grocery stores you've heard, have had separate operating hours for vulnerable populations. So early hours for the elderly to shop. And then online and remote access with updated operating hours. That was not a mandatory, but they're recommending it so that people don't end up going to a store. The other day, I'm a coffee person. I went to a Starbucks and it was closed, and I was not happy. But I looked on the app and it said that it was still open, and so I went to it. But so those are the things that they're recommending for a lot of the businesses to change their hours on, and so that people have remote access to it. Still recommending no gatherings of more than 10 people unless it's within one residential group, which means all 10 of those people live in the same house or they're within the same kind of family group that they would normally be together. And so from an employer standpoint, we've heard a lot about the factories, the Smithfield factory and the Purdue factories and stuff like that, or the Tyson factories, and having them have a big outbreak of coronavirus. We've heard of stores having some and having to shut them down in different states and everything. So they are generally in the workplace. The employers are maintaining social distancing. They're encouraging employees to work as possible from home, as many as they can. If an employee does get sick, they have to be fever-free for 72 hours without meds, and symptoms have to be resolved for 72 hours and more than 7 days since they first developed their symptoms. Any employee that develops symptoms must be separate from the remainder of the workforce and sent home. They are doing enhanced environmental cleaning. What that means is highly touched places, doorknobs, doors, and tables, surfaces. They're actually enhanced cleaning those with different, with more Clorox wipes, those type of things, antibacterial, and they're cleaning them more often. So, previously, environmental services and stuff, they don't always wipe down every door handle, but now they're wiping every door handle down multiple times a day. And then they have some other specific guidelines for retail businesses, construction and manufacturing and distribution. And those have to deal with the distancing, but also other things that require that's required of them. So they're doing, those plexiglass shields, and you've seen them at the gas stations, you've seen them at some of the stores where they're putting those up between the cashiers and the customers coming in. There's some of those are requiring that as well. So those are the main things that I wanted to touch on. I know a lot of questions are going to be coming through about how can coronavirus affect brain injury. So we will first kind of run to the question and answer portion, unless there's some burning questions that I need to answer before Alicia starts asking me questions. So I will stop sharing my screen. And we can go from there.
So I would say at this point, if anybody has a question, you can go ahead and raise your hand and we will call on you and unmute you. You can also ask a question in the chat, but to give people a little bit of time, let's kind of start with what you already started with, Dr. Bavishi. So does having a brain injury impact the recovery from COVID-19?
So having a brain injury does not impact the recovery from the virus, but people that have brain injuries could potentially have, like any virus or any infection with someone with a brain injury, they may notice that some of their symptoms worsen. So, if they have a little bit of cognitive issues like memory stuff or, speech aphasias or trouble speaking, if they get any kind of infection, a urinary tract infection, a pneumonia, or any of that, we may notice that patients with brain injuries may seem like they have a little bit of a decline in their cognitive function. So you can also see that with coronavirus or any virus really. So it's not just the coronavirus that can cause it. Now, the recovery standpoint, that's a little bit different. Brain injuries are mild, moderate, and severe. Mild are a lot of our concussion patients who otherwise are really healthy. But then we have our more severe brain injury patients who have tracheostomies, who have PEG tubes, who have other medical things that happen to them during their severe accidents, lung contusions, or frequent pneumonias. They are going to be a lot more susceptible to potentially getting this virus because their respiratory is already a little bit compromised. They could have a much worse course. So really, when we think about it, brain injury in general does not make you more susceptible to the virus. But if you have other medical things that are going on with your brain injury, then you could have a longer recovery or a worsened course.
Perfect, thank you. I don't see any other questions coming through on the chat or any hands raised, so I'll go back to our list for now. So one question people wanted to know was, can they achieve immunity without a vaccine, since you already stated we don't have one right now?
Right. So that's a really good question. One thing that there's been a lot of questions in is there something called herd immunity? So if we have a full number of people, a large number of people that have gotten the virus and they've had mild symptoms or they've had more severe symptoms, and if they recover, are they immune? Originally, the thought was that yes, people who got the virus, coronavirus, were immune. But we're starting to see data coming out of South Korea that people are getting a second infection because they thought they were immune, they stopped wearing their masks, or they stopped social distancing, and they're getting a second infection. So our previous thoughts that there would be immunity developed after you got the infection one time, it's not so much anymore. We're trying to figure out, is this virus, because of how virulent it is and its strain of it, is it rapidly replicating and changing its strain too, that it's giving people a secondary infection. So as of right now, there was thoughts out there that there could be a herd immunity if a lot of people got it, and then there will be like a whole group of people that are immune. But right now, they're not seeing it. The antibodies that they're testing for, because that's going to be the next question, like, what are these antibodies we're testing for then? Doesn't that mean we're immune? Because that's why we get antibody testing if we get our vaccines, to make sure that they took. And the answer is these antibodies are really telling us the people that did get the infection, if they've had the infection. But it doesn't necessarily tell us if they are truly immune.
Okay. So I don't see anything else coming through. So can I become infected if my takeout food is prepared by someone who has the virus? So
that's a very good question. Now, it depends on if they coughed on it. But the other thing is, heat, we do know when you cook something long enough, it will kill the virus. It will kill different viruses. So the actual food will not potentially be, because we know that the food is not a vector. So there's certain types of bugs out there, certain kinds of viruses, like hepatitis A. Hepatitis A is from kind of different types of foods. It can be from contaminated foods. But we know with coronavirus, it's not. It is aerosolized, it's through droplets. So from the takeout food itself, you know, but if the boxes that it came in or the plastic boxes or whatever it was packaged in, someone had the virus and coughed on it or whatever, and then they put it in the plastic bag and sent it along, there's a potential. So what I do, I still get takeout. I love my takeout. What I do is I come home, I put it into my own plate. I put it into my own, Tupperware or whatever, and then I get rid of the carry out stuff. I go and take it out to the trash, and then I wipe down the surface that it was on. So the food itself won't be something that can infect you. It's what potentially it's packaged in.
Oh, looks like we have a question. So Ann O. Flynn has a question. I'm going to unmute her. Go ahead and you can ask Dr. Devishi.
Do you know why people with previous heart conditions are more susceptible to the virus?
Yeah, so very good question. So we had talked about how the virus can affect blood vessels. And so some of the things that we're seeing with the virus, it has a really bad inflammatory response. So it's actually causing quite a bit of inflammation in blood vessels. So people that have cardiac disease, cardiomyopathies, different types of blood vessel abnormalities, previous strokes, or that are susceptible to more strokes, they're the ones that we're seeing this inflammatory response. And so because the coronavirus has that, people with heart disease can be more susceptible to the bad effects of it because of the inflammatory response that we're seeing in the blood vessels.
Okay, thank you.
You're welcome.
Okay. Let's do a few more unless anyone else has one that comes up. We'll unmute them. So you did a great job with the PowerPoint, but what are other resources I can turn to learn more about the COVID-19 virus if needed?
Oh, there's plenty of resources. The CDC has on their website, the cdc.gov website, has a whole coronavirus or COVID-19. They have a lot of tip sheets, fact sheets. I sent a couple to Kadar earlier. So some of those, if we can, we might be able to post them on our website too. And those tip sheets have things like what are the symptoms. They say what kinds of things they should do. Now a lot of their tip sheets talk about mask wear and some of the things that I've been talking about. So the CDC has lots of website information. Ohio State actually has a lot of information about COVID-19 on their website as well. So if you go to the Ohio State Wexner Medical Center website and you search COVID-19, they do have a lot of information. They have a COVID hotline as well. Those are the main resources, and then you look at the Ohio Department of Health. Governor DeWine and Dr. Acton have a lot of resources that they've put onto the Ohio Department of Health website. There are links that you can click for some of the things that I was talking about today. They have videos of Dr. Acton's previous press briefings about flattening the curve and what that means. They also have a lot of community resources. So who can you ask about, like what businesses are allowed to do, what they're not allowed to do, that type of thing. So there's a lot of information on the Ohio Department of Health website as well.
Okay. And then maybe one more that will kind of, unless anyone else has a question, but that will lead us into some of our upcoming sessions and kind of the reason for why we created this virtual platform for NeuroNights. But what would be some of your suggestions to help everyone fight social isolation during this time?
Oh, very good question. There's a lot of things that people can do. There's a lot of different apps out there, like the Goose Chase app is going to be really cool with being able to kind of interact with people and play games. You know, there are things like you can do Zoom. Zoom does have a lot of like platforms like this where you can get together with your friends and family. You can create Zoom meetings or Zoom parties. House Party is also another one that's out there, and they have a bunch of games on there too. So those are ways that you can connect with your family and friends. Other ways to kind of help with social distancing personally, exercise is always a great thing. It's a very good stress reliever as well. A lot of times you can't go out and exercise and ride a bike if physically you can't do it. But even just getting outside, even in your own yard, being outside and getting some fresh air, as the weather hopefully starts getting better, although it's Ohio, who knows what will happen tomorrow. But as the weather starts getting better, you know, just even being outside is helpful. Just stop not feeling like you're stuck in these four walls. You know, you can go for walks in your neighborhood. We talk about going to some of the parks, but the playgrounds are all closed, so don't go to all the playgrounds. But you can go to some of the parks, going for walks. A lot of the state parks are currently closed for people that like to be outdoors like me. But you know, we try to get out of the house as much as we can, but trying to stay away from people as much as we can. So some of those things are very helpful for social distancing. You know, and the other thing is just turn off the TV. You know, like we hear the news all day long, CNN, Fox News, like, you know, NBC. It's like I listen to Lester Holt every night, but it's like, you know, there's a point in time where you just need to escape from all of it and just turn it off. You know, just get away from it for a night. Don't listen to it all night long. I think a lot of people have really just like they're tuned in to these websites and all of this stuff. I mean, all the time. Turn it off for a half an hour. Get away from it, because, you know, yes, coronavirus is out there, but there's a lot of other things that are going on in the world, and even in your neighborhood or even in your community, that you can, you know, you can tap into. So my answer is get away from it for a half an hour. Turn off the news, turn off the TV, turn off the social media or whatever it is, because a lot of that can really make you bonkers if you're listening to it. And then you have different reports from different places and you don't know what to believe half the time. So the answer is really from a mental health standpoint, sometimes you just need to escape it for a little bit. And doing things like the scavenger hunt to just get away from it, or, you know, those type of things, it's very helpful. But yeah, turn it off for half an hour. You know, walk away from it. If you feel like you're going to miss something, don't worry. We're in a social media world, and you'll find it on the internet later. So, but really, escape is one of the biggest things.